Well, I'm Alan Dale from Gale Force Twins, and I'm having a wonderful time right here at the big raise for the Healthcare Foundation, beautiful Jag Hotel, St. John's, Newfoundland, and Labrador. I want to tell you, the noise level is going up, the excitement is building, a lot of money being raised for healthcare. Good people in this room from all walks of life. And on that note, introduce yourself, tell us what you do.
Hi, my name is Tom Cooper. I'm a big fan of Gale Force Twins. I've been on a number of times, and I was joking with Alan and Jerry, wear a number of different hats, but I'm a professor at Memorial University in strategic management. I'm an advisor. I've worked as a co-founder in the tech industry, and I'm here today because the Purposeful Group gave me a free ticket. And the Purposeful Group is a specialist consultancy based in Newfoundland and Nova Scotia, and they do some really, really interesting work, Alan, in terms of impact reporting and how you can demonstrate if you're a not-for-profit, a private corporation, or a government entity in terms of your impact from a economic standpoint, a social perspective, as well as environmental. And so the really cool thing, Alan, is that what I'm excited about what the work the Purposeful Group is doing is this is kind of the next era of accountability. So when we as taxpayers give our money to organizations or we invest in an organization, we just don't want to know like exactly what the economic, like how much profit you make. But you also want to show the economic impact, the number of jobs, the impact on productivity, how you do in terms of your environmental footprint. And that's really because of transparency. It's because of the way the world is changing these days. And so the Purposeful Group, through their awesome CEO, Chelsea McNeil, is doing some really, really interesting work, and I'm very grateful they had me at this awesome event tonight.
Interesting metrics for sure, and you're so right. People are really much more sophisticated in how they interact with their investment or even their society around them.
Yep.
Talk to me about how that impacts in healthcare. Talk to me what you're seeing there.
Well, healthcare, like we used to say in marketing, a good advertising campaign is successful. You just don't know where 80% of that success is coming from. And healthcare is the same way, Alan. When I look at the amount of money that goes into healthcare, which is so necessary, and this is why the Big Raise event is so incredible, is that what's the impact in terms of how many patients are their health is improving? What are the key performance indicators? And one of the great concepts these days is in terms of shared value, in terms of the value that comes from the healthcare, in terms of the organization, the way they're doing things, and the value that you get as a patient. And this is one of the things in terms of the ability to report, the ability to get better, and the ability to be strategic about it is really fascinating. And I see as one of the next areas of management, is the next areas, whether you're in the healthcare sector, whether you're in the marketing sector, whether you're in this awesome hotel and tourism sector. There's so many areas around impact, transparency, and reporting, which the Purposeful Group is doing a lot of work on, but this is one of the things for healthcare as well. Because healthcare is going to keep on getting more and more expensive. As people like you and I, roughly around the same age, as we get older, we're more expensive from a healthcare standpoint. So how do we make sure that we're effective and efficient while not being necessarily driven by profit?
I want to stay on the effective and efficient theme for a second. Talk to me where technology plays into that. We talk a lot about it here tonight as well.
Yeah, it's so, technology, Alan. Jerry and I, who went to school together, and we talk about how the technology has impacted a world like marketing. But when we look at healthcare, whether it's something really simple like patient records, in the last 10 years, going from paper records to being electronic records across platforms, easy one from there. The next thing, when you get your blood done, in terms of how you can speed up in terms of queuing, but also in terms of patient outcomes, like in terms of where can you make interventions, especially when we look at the Healthcare Foundation in terms of whether it's gynecology or obstetrics or in cardiac medicine or even in pediatrics, in terms of where were those interventions made? Did they work or did they not work? And that's really fascinating for me as both as a business school professor and also in terms of a lot of my family being doctors. It's like where you make the right interventions, are we making the right investments? And obviously we want everyone to have great quality healthcare, but I would say not great. We want to have awesome quality healthcare. And part of that is measuring, and part of that's reporting, and part of that is just, once again, developing strategies so that we can get better, whether it's in rehabilitation medicine, whether it's a whole spectrum in terms of the things that we're doing. Because as the world changes, Alan, as we know, it just can't be status quo, it just can't be acceptable anymore. We have to continue to get better and better and better. And technology and change management and understanding how bringing those both together can really transform our lives and our health and our society.
Professor, I love your lens on things. I love your perspective on how you look at these solutions. I want to get us down to the event here tonight. We're raising money for the Healthcare Foundation, but we're raising money in a different way. We're having fun doing it.
Oh, totally.
You've got academics in the room here. You've got government officials in the room. You've got industry partners, everybody working together and having a little bit of fun doing it.
Yeah.
Talk to me about the secret sauce in raising money in this way.
Well, I think it's, first of all, the people who started this, like Craig Rowe and Craig Tucker. Man, what great community leaders those two gentlemen are. And then Jocelyn Perry, who graduated with Jerry and I in the class of 1993, a great ambassador as well. When I go around this room, Alan, this is probably one of the ultimate networking events here in St. John's during the year. You have, like you say, you have people from all different perspectives, whether it's the mayor, who you're just interviewing, whether it's some very significant business leaders, leaders in the law, leaders in the arts community. There's a lot of leaders all in one room, but we're all trying to do the right thing. And as someone who did get a free ticket from the Purposeful Group, but also spent $350 because he wasn't very good at poker, I'm very happy to support the Healthcare Foundation and to support the big raise. It's always something, this is my first time coming, it's always something I've wanted to come. It's never worked from a timing perspective, and I just got back from our Harlow campus yesterday, but I'm really glad I came, just in terms of having chats with some really interesting people, seeing a lot of my former students here and on all the success they've had, and getting to speak to Gale Force Winds as well.
Professor, always a pleasure to have you on the show. You have a beautiful lens on life and you articulate it so well. We appreciate what you're doing here. Thank you.
Thank you very much, Alan. Great to see you.